Okay, so this is Dr. RJB, and I'm going to talk about breast cancer this time. Um, Previous video, I talked about prostate cancer being the most common male cancer. Breast cancer is the most common female cancer. So, of all the cancers in women, this is the one that's the most common. Now, because of the state of the art, the survival rate from breast cancer is fairly good. Approximately 90% of breast cancers survive at 5 years. In most cancers, 5 years is a pretty good indicator that somebody is doing good. If somebody survives to 5 years, their success in trying to beat the cancer is pretty darn good. Now, breast cancer also, you have to take a look at the stage of the cancer. Staging is between 1 and 4, fourth being the worst, 1 being the best. Let's talk about this staging idea. Stage 1 in any cancer is basically where the cancer is very small, has not moved from the area that it is in, is pretty much contained by the body. Stage 2 is a situation where the cancer has grown into the area around it. So a breast cancer would mean it would be invading into the same breast. Stage 3 is when the cancer has moved out of the area and has gone into the lymph nodes. So this basically would be the situation where it's already started to spread somewhat. Stage 4 means that it's gone to some other organ. So meaning breast cancer that's gone to the liver or some other organ of the body. In breast cancer, the most common areas for it to go to would be, other areas to go to would be the bone. So we try to treat breast cancer to prevent it from spreading any other place, and also to increase survival rates. Now, stage 1, it used to be the case that all that happened was the surgeon would remove the spots and say, "I've cured you, go home and live a good life." These days, what's done is that a woman who has stage 1 has the area removed, and then basically they will receive chemotherapy. With stage 2, it depends on how severe the spread is, but either they're going to remove that area of the breast, or talk to about a simple type mastectomy. Stage 3, we're probably talking about removal of some tissue and also removal of some of the lymph nodes. And then for stage 3 and stage 4, for stage 2 and 3, definitely chemotherapy, and also possibly radiation therapy. Stage 4, definitely we're talking about chemotherapy and radiation therapy to the general area, the lymph nodes, etc. And depending on where it's spread, discussion of treatment of the area that's spread also. Now, we hope to see simple breast cancers. And the way to get that is go for the mammograms. Now, I know mammograms are uncomfortable, so I'm not going to tell you that you're going to enjoy getting a mammogram done. I don't enjoy getting a prostate exam done when I go to my urologist. I don't particularly care for that. But that's life. You got to do certain things to make sure that you don't have any sign of cancer. So what would you prefer? Do you want to have a stage 1 breast cancer, or do you want to have a stage 4 breast cancer? You're not going to know, if that breast cancer has gone on beyond the area where it started. I mean, come on. These things tend to start out as little tiny things. When we look at a mammogram, the mammographers over at one of the hospital used to have a special room that they turned the lights off because all they wanted to see was the mammogram. The mammogram is placed over a light box that shines through the film. These days it's all electronically done, but the whole idea is that the mammographer has to pay attention and concentrate on what he's doing because he doesn't want to miss something very tiny. Sometimes all that they see is 4 dots. And those 4 dots are dots of calcium. And that's the indication that there's a prostate cancer there. So when you're looking at a film and you have to find 4 little dots, it sometimes can be kind of hard, especially that the mammography is not a nice picture. It's a picture that is confused by the rest of the breast tissue, any fibrous tissue that's in there may hide the breast cancer. So sometimes the mammographer will tell the x-ray person, I want another picture. Do another side view, do another this view, because they're just not sure. So it's, because of that, when they talk about getting mammograms like every 3 years, which is one of the recommendations that I've seen, it always concerns me. And this is why. It's very possible for them to miss it. And so, okay, you're going every 3 years. Let's say at day 1, they've missed it. Okay. Now, 3 years later, it still might be relatively small, and maybe they're unsure. So maybe they miss it then too. 3 more years later, it's now 6 years that this thing has grown, and it's probably too late to do a lot of stuff for it. But if, let's just say you did the mammogram on day 1, and a year later, you did another mammogram, and even if it's missed the second time, you're going to do a mammogram 2 years. And now the thing is only grown for 2 years. It's not a big deal when we're talking about breast cancer. It doesn't grow that fast. So in 2 years' time, they catch it. That's good. So doing a mammogram every year for my patients was the standard. Even though the recommendation was every 3 years, I always felt that was unsafe. Even if it's missed on day 1 and caught on 3 years later, that's still 3 years. That's a long time, So I always kind of felt, let's do it every year. It's more discomfort, I understand, but it's worth it. Since it is the most common cancer in women, you want to do whatever you can to find it. Okay, so these are some of the statistics and treatments for breast cancer. Try out some of my other videos if you would. Okay, take care.